Medication administration training, based on Nonotuck's medication management and safe medication policy and procedures. Medication management policy for AFC. First and foremost, people will need an assessment of medication management skills in members living in the community to identify specific problems, aid in planning medication management, and to promote independence. Members and caregivers are assessed on their ability to perform all aspects of medication management tasks, including adherence to medical appointments, obtaining and filing prescriptions, understanding medication instructions and side effects, and the ability or assistance needed to comply with the prescription orders. The goals will be assessed at monthly home visits via review of medical appointments, consultations, medication lists, and reports from both the caregiver and member. Medication management policy. Anyone involved in medication administration, such as family or respite, should have knowledge of the side effects, emergency medical procedures, and any special instructions for administering the medication. Any medication error which results in physical or emotional injury should be reported to DPPC. This is Nonotuck's Safe Medication Practices sheet. It discusses the ways to properly fill a prescription, how to properly document, and how to properly administer medication. It should be reviewed with the caregiver and person served initially and as needed thereafter. It also discusses proper storage and disposal of medication, the proper things needed in order to have psychiatric medications on hand, and what to do and who to call if there's a medication error. Safe medication practices. All employees and providers will review safe medication practices initially and as needed. Medication needs are assessed on an individual basis to determine whether the medication is appropriate for the person served. Medication management skills of people served are assessed by completing the self-medication packet. Self-medication packet. The self-medication assessment is filled out by the case manager with assistance and input from the caregiver, person served, and other team members. A support plan is also included in the self-medication packet and should be implemented and reviewed regardless of someone's ability to self-medicate. Some people served may be considered independent with setup support. They may use a medication chart and sign off on their own, or they could require assistance with medication administration from their shared living provider. Here is Nonotuck's self-medication packet. CMs work with the person served to assess their abilities to self-medicate and develop a support plan and teaching plan to best suit their needs and goals for self-medication. The self-medication packet should be completed initially and annually or as needed. Self-medication continued. Self-medicating is preferred and encouraged, and each person served is involved to the best of their ability in all medical and medication decisions affecting their lives. Medication administration is gently tried 2 or 3 times before it is considered refused. Repeated incidents of refused medication is brought to the attention of the physician for further instructions. We encourage non-PRN orders written as taken AM and PM to avoid strict times of 8 AM and 8 PM. It only needs to be time specific if a doctor feels it is needed and writes a certain day/time for it to be given. Many people utilize a daily and/or weekly medication box. This can be helpful to those administering medication to maintain dosage and schedules of certain medications. Prescriptions and medications. It all starts with the physician. Filling a prescription. All prescriptions must be filled and begun within 24 hours of the doctor's orders, unless otherwise noted by the physician. Medication of any kind, prescription or non-prescription, is never started or stopped without a doctor's order. All prescriptions must have a pharmacy label. Here's an example pharmacy label from CVS. As you can see at the top, you have your store number, followed by the person's name receiving the medication, as well as the prescription name or the medication name to follow. Below, any specific directions that correspond to the medication will be listed. At the bottom, you will find the RX number corresponding to that medication. Documentation, the key to effective and safe medication practices. Here's an example of Nonotuck's medication consent form. This form is completed by the CM initially and annually thereafter, or as needed. Persons served and/or guardians are required to sign off on this form annually to acknowledge that their medication rights have been reviewed. Medication chart content. Medication charts are required for all individuals that do not self-medicate. Medication charts must include the following: both the brand name and the generic name of each medication, route, dose, frequency, stop and start dates for each medication, all medication used that month, prescription and non-prescription, any allergies the person has, any special instructions for a specific medication, discontinued medication, and any errors in the documentation are corrected with a single line through the error, the person's initials, and an explanation. Do not white out or blot out an error. Here is non-Atux medication list document for AFC. It is organized by several sections including medication name, dose, frequency, and comments for any special instructions or relevant information corresponding to that medication. Here is non-Atux monthly medication log for people receiving DDS funding. Those administering medications are required to complete this form and submit to the care manager on a monthly basis. Signed medication forms are required for all medications, whether they are prescription or non-prescription. This requirement can be satisfied by the medication order verification or a signed healthcare encounter form. Side effect sheets are required for each medication. Each provider has available to them a list of medication abbreviations and measurements. PRN medications have specific instructions on when to stop and start the medication. This is the healthcare encounter form. It is taken to each medical appointment and summarizes the purpose of the visit and any follow-up needed moving forward. The form may also be used for medication orders. Typically, CMs will collect this form during their monthly home visits. Here is the over-the-counter medication order form. This form discusses and outlines the PRNs and stock medications that are not always needed, such as Tylenol, cough medicine, moisturizing cream, to make sure that each person served and their provider are aware of the guidelines to follow when administering and using these medications. The form is to be signed off by the healthcare physician every 6 months and kept in the person's record. Side effect sheets are required for each medication. They come with the medication from the pharmacy, or you can use the internet to locate a side effect sheet for any specific medication. Example websites include WebMD, drugs.com, or rxlist.com. If a medication is discontinued, the corresponding side effect sheet should remain in the person's record for 1 year. Here is an example side effect sheet taken from drugs.com. Medication administration, a part of safe medication policy. Always check the 6 rights when administering medication. Number 1, right person, to ensure that the correct person is receiving the medication. Number 2, right route, to ensure that the method in which the medication is being administered is correct. Number 3, right dose, to make sure that the amount of medication that's being administered is correct. Number 4, right time, which relates to the time of day or times of day and ensuring that that is correct. Number 5, right medication, ensuring that the correct medication is being administered. And number 6, right documentation, to ensure that the correct documentation is being properly filled out and completed. Missed medication is never made up or doubled up unless directed by the physician. It is best to give pills first, wait a few minutes, and then give liquids. All liquids should be shaken first. In specific circumstances, on a case-by-case basis, IV or IM medications may be administered by providers who are trained and comfortable to do so, or may be arranged to be given by medical professional as appropriate, for example, VNAs. Documentation of training for these procedures must be provided and kept in the person's record. Important tips for administering medication. Stay with the person until he or she has taken the medication. Prepare and give medications to one person at a time if there are multiple people living in the household. Follow all directions carefully. For example, give with water, give with food, give on an empty stomach, avoid sunlight, avoid alcohol, avoid working with machinery or driving, and follow the 6 rights and make sure you know them. Medication administration, storage and disposal. Storage and disposal. If there is a risk of misuse or missing medication, then the medication should be locked up. If more than one person is served in the household, then medications should be stored separately, including topicals separated from oral meds. Outdated, discontinued, or improperly labeled medication should be disposed of. If a pharmacy will allow the return of medications, that is the best option. If not, dissolve them in sand or cat litter and throw them in the garbage. It is suggested that controlled substances be documented when discarded. Light and temperature instructions must be followed. Medication administration, psychiatric medication. As a regulation, medication shall not be used as a punishment or for anybody's convenience. Medication shall not be used as a substitute for programming. If psychiatric medication is used, there's a psychiatric medication plan that corresponds. The clinician must be informed within 24 hours of any new or changed psychiatric medication, and a treatment plan is updated or created. If a person is receiving psychiatric medication, a psychiatrist must see the individual quarterly or as needed to review the medication. These visits must be documented with a physician encounter form. If psychiatric medication is prescribed, the shared living provider is responsible for collecting data as requested by the clinician for monthly review and quarterly reports to the psychiatrist, or as the psychiatrist prescribes. If antipsychotic medication is prescribed and the individual is unable to get informed consent, then a Rogers order is required. Non-toxic medication treatment plan is used to outline and monitor a person's diagnoses, any targeted behaviors that the psychiatric medication is being used to address, and possible side effects that may correspond with that medication. It is created by the clinician with input from the rest of the team. It's updated annually or as needed if there are any medication changes. Please refer to the medication treatment plan training for more specific information and education. Here's an example Rogers order form. Rogers orders are legal documents ordered by the court. They are used in order to make sure that a person who is unable to give consent is still able to take psychiatric medication and ensure their rights are not being violated. They specify specific prescribing parameters, and they have a duration and require to be updated and approved by the court on a regular basis. Medication administration, AFC medication, policy, and practices. People should take their medications exactly as directed by their healthcare provider. Ask the prescribing physician what to do if a dose is missed. Review all medications with healthcare providers at each visit. Use the same pharmacy for all prescription medications, and read the labels on the medications carefully. Make sure to ask for clarification if needed. Maintain a list of all allergies and adverse reactions to drugs that have occurred. And review current and acceptable methods for private home medication disposal. The following are medication practices that may cause harm to the person taking the medication. Taking a medication that is expired, putting different medications in the same container, stopping a medication without talking to a healthcare provider, altering a medication or a medication route is taken without talking to a healthcare provider, and sharing medication with someone else.
Medication administration continued. Here's where we talk about medication errors.
Each of the following are considered medication errors. Not giving medication for any reason other than a refusal or a doctor's order, giving a medication more than 1 hour after the prescribed time frame, giving the incorrect medication, giving a person someone else's medication, giving a person an unauthorized medication, not filling a prescription within 24 hours, and not following the doctor/prescriber or pharmacist special instructions. In the event of a medication error, shared living providers should first call the prescriber and/or pharmacist as soon as an error is identified. Follow their instructions. Next, they should notify their non-ATUC contact person or on-call and document the error on the medication chart. If the error results in physical or emotional injury, it should be documented as an incident report and reported to DPPC or Elder Services. Medication is a very serious part of the services we offer and must be taken seriously. Follow all reviewed guidelines to prevent any medication errors. Here is the DPPC pamphlet that is reviewed with shared living providers and people served. It outlines the steps that should be followed if there is a medication error that results in physical or emotional injury. This pamphlet should be kept in every home and accessible to household members. For more information, please refer to the Human Rights and DPPC training.